I went to my first seminar with Dr. Keller, and being the skeptic I am, I've been to many seminars over the years, and they don't always pan out to be what they're purported to be. Well, my wife, who has many crowns in her mouth, struggled to have healthy gums. She would brush and floss every single day as I watched her do it. And we put her on Perio Protect, and unbelievably, the bleeding just disappeared. I wouldn't have believed it if I hadn't seen it with my own eyes, and I was sold from then on. The Perio Protect has benefited hundreds of our patients to that end.
Well, we were pretty amazed in the office because we'd been treating periodontal disease for many years, and we'd come to expect very limited results. So whenever we started down a path with a new treatment, we didn't expect anything fantastic, but oh, were we wrong. We soon found that the Perio Protect method provided us with results that we'd never seen before. And not only were we happy in the office, but the patients were ecstatic too.
The way that I started Perio Protect is I tried it on patients who had relapse from periodontal disease, previously had periodontal surgery with relapse. And so for both of these patients, they both kept a logbook. They both used the trays 4 to 6 times a day for the first 2 weeks. Both of them came back with nothing short of spectacular results. In 2 weeks, gum line bleeding was eliminated on both of them. Pocket depths were down significantly. They were so motivated, even their teeth started to turn whiter, and both of them mentioned to me that their gums felt tighter. And I looked at their gums, and they were no longer shiny, swollen gums. They were firm. They didn't bleed on probing. They were teenage gums. I was just amazed at how great they looked.
I had an experience that was practice changing. And one of these patients had been in the trays for perhaps 3 months. As I looked at her gingiva, it was a bright, healthy pink that I had never seen before. Healthy gingiva that, as a periodontist, I have little opportunity to see.
I had, been somewhat familiar with it, heard of some of these results, and have to admit, may have been a little bit of a skeptic myself. But when I started to see in the office that I was at, the decrease in some of these numbers, these perio pocket numbers going from 7s and 6s up to 5s and 4s and then even to 3s, I was completely amazed.
Almost any dentist that you talk to has the drawer. It's the drawer where the treatments and the tools and the instruments that they had and didn't work, they go into that drawer. And so anytime we undertake a new treatment, you start to worry in the back of your mind if that's going to end up in the drawer. Well, when we started Perio Protect, it wasn't very long before we realized that this was not going to have to go in the drawer. It was a treatment that not only worked, but it worked quite quickly. And it was something that not only the dentist and the staff could see results from, but the patients could see results from.